Hello everyone, in this video our group will try to talk about whether the market incentive can help to the healthy care market. At the beginning, let's think of this question. What would you do before you want to buy a cell phone? I think most of you will firstly search it on Amazon to get the normal price before you buy it. But now if you want to make a healthy care decision, can you get the price before you pay the bill? Of course not. The personal bill you get is only related to the service. The expenses is often determined by how many products are done, not whether the problem is fixed. As you know, the healthy care market is not like a normal market. Therefore, we should consider this question. What is the main differences between healthy care market and free market? As we said before, the health market is not like a normal market, which means the doctor often know much more about medicine than the patients. So the information is asymmetric. So, for this special market, the government has already made many efforts, in which the most familiar to us is Obamacare. But now there is an argument from the Republicans who are going to try to do it use a more market-friendly mechanisms. They want to introduce more market incentives to the healthcare market, but for a market which has more serious information asymmetric, the market mechanisms really works better than the government control. Our group will focus on this program and give our suggestion.
In healthcare market, the most obvious problem is asymmetric information. In this part, I'm going to show the price dispersion in drug markets in America, which is due to the asymmetric information. This research is done by Sorensen. The data in the paper comes from 2 small towns in New York State. Why these 2 markets? One reason is that state legislation requires all pharmacies to post drugs prices. Thus, drugs price information can be get efficiently. Another reason is that these 2 towns has well-defined local markets. The main prediction in this paper is that drug purchase frequently exhibit lower markups and less dispersion. After the regression test, it shows that price range for drugs purchased monthly is 28% lower than one-time purchase, which is consistent with their prediction. The causal relationship behind this price dispersion can be concluded into these 4 terms. Drug characteristic. It is the effect of drugs, like it is used to cure chronic disease or drugs a cold. This can influence the purchase frequency. Intuitively, purchase frequency is dependent by the dosage and duration of drugs, which can result in higher or lower search costs. Search cost is the price shopping for lower price. It is a main factor that can cause price dispersion. For example, if someone wants to buy drugs for diabetes, which is the chronic disease, hence he needs to buy these drugs regularly, since the search cost for him is quite low. Every time he may go to different pharmacies, and then he can get more information about drug prices. As a result, there will be less price dispersion in these kinds of drugs. There are some alternative explanations for this price dispersion. Think about the pharmacy heterogeneity. You may say that if a pharmacy offers better service, then it may set higher prices, and this can lead to higher price dispersion. But this paper finds out that it cannot explain 100% of the price dispersion in drug markets.
Well, as we said before, the Republicans have been trying to replace Obamacare, trying to introduce more normal market incentives. In the following part, we also look at American healthcare industry to discuss the effect of market-friendly mechanism on resolving asymmetric information issue. The goal of some measures in Republican plan, like refundable tax credits and health saving accounts, is that citizens could shop for their own to choose any procedures. That is to say, people now need to know much about information of drugs and units, so that they could be able to evaluate comparative cost and quality, and then make decisions. Of course, Many people would say they have no time to show the actual cognitive burden of shopping for healthcare, and they don't believe in themselves, but they also cannot trust completely doctors, definitely. This is a distrustful society. However, the internet and other mechanisms nowadays help customers acquire more information. For example, in terms of price dispersion problem, if all pharmacies post information of drugs online, including price, usage, and effect, buyers could easily search online and buy the satisfying and cheapest one. Also, sophisticated modeling helps with unpredictability in a bunch of fields, like body fat devices and heart rate, pressure devices. Furthermore, some researches indirectly show that healthcare customers are more rational and intelligent. Higher performing hospitals keep higher market share over time, which means customers know the quality, and this fact will motivate other hospitals to enhance themselves. In sum, there is a big chunk of evidence that market incentive will work in healthcare, especially in non-acute care. It is more easy and convenient for people to access to information they need. They could learn, then choose. So asymmetric information would not be so severe in healthcare industry.
Now I will introduce some existing problems from another perspective. In general, healthcare system is never like a normal market. There are several features. First, people's needs for healthcare are unpredictable, unlike food and clothing. Second, the doctor-patient relationship is unique and demands a high level of trust. Third, the service providers know much more than patients do, so the information is hopelessly asymmetric. Fourth, patients actually cannot make normal choices because payment comes after care, not before. When you make most healthcare decisions, you don't get much more information on comparative cost or quality. The personal bill you get is only related to the services. The expense is often determined by how many procedures are done, not whether the problem is fixed. The internet and other mechanisms can help customers acquire more information. But there is also other problems about politics. Insurance companies, patients, drug suppliers, and hospitals are all closely related to healthcare system. Insurance policy also involves social welfare distribution. This is a distrustful society. People may not want the added burdens of making healthcare decisions on top of all the others, and they may not want what they perceive as another risk factor in their lives. In conclusion, since healthcare market is quite special, we cannot simply generalize solutions to asymmetric information problems in this market. Politics also makes it a big and complex topic. That's all for our presentation. Thank you.